Hello, my name is Dr. Abdullayev, and I am the Dean of Pharmacy Faculty. And we decided to make a video presentation about rules of behavior for students of our International Medical University. And I invited the best students, and they will answer or they will tell about rules of our university. And my assistant, Alia, will start. Please, Alia.
Hello everyone, my name is Alia and I'm a student of Faculty General Medicine and I will assist my teacher. And today we're going to talk about the behavior of students. And if you want to become a good doctor, you should develop your self-discipline in the first year of education. We are very proud of top students of our university. We are very friendly. It's fantastic that we are from different nationalities. For example, Ayima and Aymena, they are Kyrgyz. Ksenia is Russian. Mediko is Turkish. Halima is Tungan. Rizul and Sapna are Indian. Allah is Egyptian, and these good lookers are from Pakistan, Syria and Bangladesh. A medical student should never be late for classes. Students should come to the classroom for about 5 or 10 minutes earlier, before the start of classes, and then clean their desk, equipments and their workplaces. Our best students is Osama Mahbub, Asad Abbas, Ziaullah, Sanaullah, and Burhan Ijaz. They will tell about the rules of conduct for medical students. First, Osama, please.
A white coat of the medical student is the symbol of cleanliness, and a future doctor should always respect the white coat. He should always wear it clean and ironed, and a medical student should always look perfect. Here are some examples of the students who do not wear it properly. These students do not look like medical students. We will now show you how to properly fold the white coat. And here, please.
I'm Dr. Abbas from International Medical University. I often observe many foreign students sit on dirty floor, dirty stairs. Actually, we are doctors. We make ourselves healthy, we make ourselves clean because we are a savior of mankind. We have to save the patients. When the doctor is also dirty, when doctor is also a patient, how we can treat the patients. Okay, you can see here, these are some students that are sitting on the dirty floor. There are many pathogens, there are many bacteria, many parasites that infect the patients. They cause many respiratory diseases, many digestive system diseases. So there are some examples of diseases that can be caused by parasites, bacteria. Actually, first of all, I am going to explain about gastrointestinal flow. Actually, it is a parasite that is present in a first host like sheep. It is present in a flock, it is present in a dogs. But when it came in a contact with the human body, it caused infections. So how these infections infect the patients? Actually, first of all, they affect our respiratory system. After that, it affect our cardiac system. After that, it also affect on the livers. You can see here, there is a cirrhosis of liver. That is the first of all, it cause inflammation. After that, when inflammation came in a chronic stage, it's called cirrhosis. So we have to make sure that how we can clean ourselves. I advise to the doctors, I advise to the students, don't sit on the dirty floor, don't sit on the stairs. So it is not a good doctor's behavior. We have to make sure we are doctors, we make ourselves best. Thank you very much.
Hello, my name is Ziaullah. I am from International Medical University. So my part is about to educate you about the following. So don't throw the garbage and everywhere. We have special bins in the corridors and in the corner of every floor. So use that for trash purposes. And also, if the teacher wants you to educate about the simulation-based or practice class, so if they use the university stuff, so use it with special care and don't harm the university stuff. So use it as your own property. So use the university material as your own property. Corridor 5th floor जैसा कि 6th floor इसमें बहुत ज़्यादा रश वगैरह होता है, तो हमने हर एक कॉर्नर में और हर एक मिडल ऑफ द कॉरिडोर हमने स्पेशल डस्टबिन वगैरह रखे, तो आपकी कोई एक्स्ट्रा ट्रैश वगैरह हो तो आप उसे यूज़ कर सकते हैं। हर एक जगह आपको उसे मतलब फेंकने की ज़रूरत नहीं है। आल्सो मोस्ट इम्पॉर्टेंटली आपको अपना क्लासरूम वगैरह उसका स्पेशल ध्यान रखना चाहिए। आपकी चेयर्स वगैरह हो गई, उसको आपने क्लीन रखना है और काम रखना है, और हर जगह आपने गंद वगैरह नहीं फेंकनी है। और प्रैक्टिस बेस पे अगर कोई टीचर वगैरह यूनिवर्सिटी की कोई स्टफ वगैरह आपको यूज़ करना चाहे तो उसको आपने काइंडली और मोस्ट जेंटली तरीके से यूज़ करना है, ताकि उसको कोई हार्म वगैरह ना हो, क्योंकि वो यूनिवर्सिटी की प्रॉपर्टी है और आपको उसे अपनी तरीके और आसानी के साथ मतलब उसको कोई हार्म वगैरह ना हो, तो इस तरीके से आपने उसको डील करना है ताकि यूनिवर्सिटी का कोई लॉस वगैरह ना हो।
My name is Naula and I'm going to talk about the thing which is become a fashion in the young generation, especially in the university, is smoking. It is very dangerous for the students. It consists of a lot of dangerous substances, around 7,000 chemicals, of which 70 are carcinogenic. It consists of like polyaromatic hydrocarbon, benzene, toluene, acrolein, cadmium, and many others like carbon monoxide, which are cancer causing. And it also consists of the radioactive substances like polonium, deuterium, and lead, which cause the cancer not only in the respiratory system but also in other systems like heart, in also digestive system, also reproductive system. It causes the damage of the nervous system as well. So a thing which is so much dangerous must be prohibited, and it is prohibited in the university. Say no to smoke.
I am Burhani Jaz, and I am here to highlight something very important. As we know, a healthy body has a healthy mind. So it is very important to maintain our body, to go for in sports and to do exercises daily. So every medical student is obliged to do physical exercise every day, and it is very important to go for in sports. And so if we are doing our daily exercises, it will make our body healthy, and we can do our everyday duties perfectly, and it will help us to do our patients treat properly. Next slide, please. So as we know, for a doctor to maintain hygiene is very important, because we have to see patients, we have to meet them, and we have to go in surgical wards and to those areas which are very clean. So maintaining hygiene is very important. So if for a medical student, it is very important to keep their body clean, to keep their clothes very clean, to keep environment around them clean, and to take shower twice a week at least. So as we know, cleanliness is half of our faith. Safai nisfe iman hai. So we have to keep the cleanliness around us, keep ourselves clean, and keep our university clean. Thank you so much.
Student must be disciplined to respect teachers and other students in the corridor and in the stairwell. Always move on the right side and always leave the passage in the middle. They should greet the teachers even if they are not familiar.
So dear fellows, discipline makes man perfect. Discipline makes life easier. So as my fellow students have explained you practically that how to sit in class, how to behave in university premises. So guys, show some discipline in university areas, not only in your university, in also city, in your streets, in your local transport, because we are international students here, we represent our culture there. So guys, show some discipline. You are the representative of your nation. So best of luck for your studies. As you know, disciplines makes life easier. Thank you so much.
Thank you very much for watching, dear students, and we hope that the students of our university will become exemplary and the best.